Muscular dystrophy is a muscle wasting disease caused by genetic mutations which interfere with the normal production of proteins necessary to maintain muscle function and integrity. As such, patients are unable to build and repair muscle and experience gradual atrophy over the course of a lifetime, leading to a decreased quality of life. There are many forms of muscular dystrophy, but the most common are Duchenne's and Becker's muscular dystrophy. Duchenne's muscular dystrophy is an X-linked recessive disorder. As such, it generally affects young males. Duchenne's is caused by changes to the DMD gene, which produces the protein dystrophin. Dystrophin is a large structural protein which is responsible for linking actin within the cytoskeleton to dystrophin-associated proteins in the ECM. Abnormal functional loss of structure leads to compromised structural integrity of muscle fibers and the inevitable damage and deterioration of muscle tissue. In Becker's muscular dystrophy, structurally shortened dystrophin is produced compared to the complete loss of functional dystrophin that is seen in Duchenne's. This occurs due to in-frame deletions and duplications which lead to altered protein size. Due to the decrease in functional dystrophin, patients tend to experience gradual degeneration of muscle tissue over the course of a lifetime, as the muscles waste away without the contractional protection afforded to it by dystrophin. Approximately 1 in every 18,000 to 35,000 children are born with Becker's muscular dystrophy, compared to Duchenne's, with approximately 1 in 3,500 being born with the disease. Due to the pathogenesis of the disorder, Duchenne's sufferers tend to experience a faster progression of disease than those with Becker's, with accelerated muscular atrophy and a generally hastened manifestation of fatal complications. Duchenne's sufferers tend to be debilitated to the point of wheelchair dependency by the age of 12, whereas Becker's sufferers typically experience similar levels of muscular atrophy and impairment in their 40s or 50s. Diagnostic testing is widely used to detect various forms of muscular dystrophy from a young age. The most widely used method of detection involves a polymerase chain reaction of the most commonly known deleted exons, which can detect 98% of all deletions, but is unable to detect duplication mutations. Newer methods that can detect both deletions and duplications have been developed recently, which involves the quantitative analysis of all exons of the dystrophin gene. To combat the prevalence of muscular dystrophy, various governments have trialled population-wide screening programs. The most published program has been implemented in Wales and has been running for over 20 years. The screening is used to detect muscular dystrophy in newborns and allows families the opportunity to begin their preparation to mitigate the condition and improve the overall quality of life for the child. However, such programs have managed to spark controversy, especially in tandem with the proposition of screening for muscular dystrophy before birth. Such procedures may be regarded as invasive by some, with the notion of taking intervening action before the birth of a child as a dangerous territory to venture into.